There seems to be a lot of publicity around dental implants at the moment. I'd like to know, are they a recent technology and also some history, Dan?
Steve, we can trace dental implants back 4,000 years to the Chinese. And the current technologies that we use are from research in the 1960s by Professor Brånemark, who found that bone would integrate or adhere to titanium. And cases that he did in the 1960s are still in function today. So it's an extremely well-proven procedure.
Okay.
But since the 1960s, there have been great advancements in diagnostics, in research, and the experience of a few senior dentists who are dedicated to the advancement of this procedure.
Indeed, and I understand that you personally are part of recent advancements through your work here at the Brenner Implant Institute.
The wonderful thing about advanced dentistry, Steve, is that dentists at the forefront of this profession are eager to share their experiences and findings with other dentists. And I do that here at the Brenner Implant Institute through providing postgraduate training to dentists. We take them through the academic side of implant dentistry all the way to them placing implants in their patients here at the Brenner Implant Institute under our guidance and supervision.
So they bring their own patients actually here?
Yes, they do.
And Dan, tell me a little about the advancements with materials used these days.
The original implants were smooth surfaced, and these worked very well in the front jaws of patients. However, they were found to fail in softer bone, so advances in technology have found that if we put a rough surface on the implants, these implants can be used with equal success anywhere in the jaws. And the latest advancement in technology is the laser etching of the top part of the implant. And this allows the gum to seal against the implant in a very similar way to that of your gum sealing around your tooth.
And diagnostic equipment and guidance systems.
CT and cone beam technologies now give us a true three-dimensional picture of the available bone and the anatomic structures like the sinuses and the nerves. The advances in this scanning technology also enable us to have computer-generated surgical guides to assist with our surgery.
And a subject that I know is dear to your heart, the All-on-4 procedure. Could you tell us a bit about that?
The All-on-4 procedure was invented by Professor Paulo Malo of Portugal. His brilliance has enabled us to provide a full set of teeth in 2 to 5 days for someone, avoiding most of the complicated bone grafting that we used to do.
So only 2 to 5 days?
Yes.
And Dan, typically what's the role of radiology these days?
Well, Steve, you might remember we used to have our dental films, and these were only two-dimensional. And then we had the OPGs.
OPG?
This is a film that goes around your head, a machine that goes around your head and shows us the jaws, but only in 2 dimensions.
Okay.
For these advanced procedures, we really do need 3-dimensional information, and all of our cases are planned with CT or cone beam technologies. Quite simply, Steve, the more we can see, the better we can plan.
And a final question for you. What's the usual case time for an implant procedure?
Like any advanced procedure, it will vary from case to case.
Okay.
If we're placing 1 or more implants, this may take 4 months to a year, depending on whether you need bone grafting.
Right.
For our All-on-4 cases, once we understand our patient's needs and desires, this can take 6 visits over 4 weeks to start enjoying solid food, enjoying life without dentures.
So, functional teeth, a better smile, a great quality of life, and it doesn't take long at all.
Absolutely.